right, many thanks, Ibrahim Bello Gunda, for that background report. And now joining us for the conversation with borders on wrong medical diagnosis, challenges and solutions. Let me first introduce here in the studio Dr. Kasmir Ifai. He's the 15th National President, Association of Medical Laboratory Scientists of Nigeria. He's also a fellow of the West Africa Postgraduate College of Medical Laboratory Scientists and a public health advocate. It's a pleasure to welcome you to Good Morning Nigeria.
Good morning, viewers.
All right, we have also been joined here in the studio by Dr. John Tor Abidie, who is a neurotoxicologist and integrative medicine expert. He is also founder and CEO in country at Medicare Abuja. We thank you very much for coming on the program.
Thank you.
All right, we're not done with our guest yet. We still have with us right here in the studio Dr. Aruna Afiz. He's a consultant neurosurgeon at the National Hospital, Abuja. Many thanks for joining us, Doctor.
Thank you for having me.
All right, and joining us via Zoom all the way from Lagos is Dr. Abiodun Oshiemi, CEO, Forensic Science Consultants, Legal Medicine Consultant, Oxford Health Consultants. Glad to have you join us, sir.
Thank you very much.
All right, let's begin the conversation from here in the studio. And I'd like to begin with Dr. Kasmir Ifai for obvious reasons. When we talk diagnosis, well, you don't do a lot of diagnosis without the labs. And so I'd like to ask, how common is it in your line of duty to misdiagnose or to get it wrong?
Thank you very much. It's quite common in low and medium income countries compared to developed climes.
Like Nigeria, right?
Like Nigeria. You see, if we look at data from the World Health Organization, they would want to categorize wrong diagnosis to be prevalent as much as between 5 to 15%. And they had to cascade it down to also say that in primary health care, it is a lot higher, closer to 15%, and in inpatient care in developed climes like the US, it's as low as 0.7%. But overall in the United States, there's a death attributable to wrong diagnosis of close to 12 million per annum. So let's come back. You have asked how close it is. I mean, how common it is with what we do in Nigeria. If we come close to Nigeria, you'll find out that the truth of the matter is that wrong diagnosis is common as the diagnosis of malaria. It's common as is common in the diagnosis of tuberculosis.
Why?
It's very common and a lot more rampant in diseases like cancer, where we have data, as scanty as it may be, that close to 70% of cancer cases are misdiagnosed. And of course, we have instances we can reference. As it were, most of them had gone to the great beyond. Somebody was being treated in Nigeria here for a pulmonary condition, respiratory condition, only to go abroad, and they found out that he had cancer. Some other person was also treated here, very prominent Nigerians, also to go abroad. First was told he had no cancer. That was abroad. Later, that individual died of cancer. So the point is this. You have asked why. We must flesh out this wrong diagnosis into three. First is misdiagnosis, MIS diagnosis. Second is delayed diagnosis. Third is missed diagnosis, MISSED. Now, miss means I identify incorrectly what is wrong with a patient. Misdiagnosis. Delay. It takes protracted time, an unusual time, for us to arrive at a correct diagnosis. Probably the patient presented late, or we do not have facilities or capacities to make that kind of diagnosis. And then we have MISSED, missed diagnosis. In that instance, a patient is coming and you are telling the patient nothing is wrong with you. You can't really make a diagnosis about what is wrong with that particular patient. So I needed to flesh out this because they look alike. Now, one reason why wrong diagnosis is preponderant in Nigeria has to do with state of health infrastructure. It has to do with capacity for diagnosis, which will now speak to human resource, and material and equipment. And then the monster prevalent in Nigeria, for instance, that monster is called quackery. When you have charlatans in medical laboratory services, providing medical laboratory services, for instance, you are certain to have preponderance of wrong diagnosis. These are people who have less to no training about providing such service, who are not certificated and licensed to provide that kind of service. You have school dropouts. You have people who have studied some related biological science courses who are justly to come begin to test patient samples to provide laboratory care. When you have all that, and what I have categorized into two, quack, when you talk about quack, I talk about facultative quack, and I talk about obligate quack. So these ones are the ones fueling wrong diagnosis, making it worse in Nigeria. Who are facultative quacks? I study zoology. And because in the course of my training, of course, there will be some aspect of laboratory. And so I leave school and I want to come work in National Hospital Laboratory. All right? I studied pharmacy. I'm a pharmacist. I have a shop. Or I'm a nurse. I have a nursing home. And so a patient comes, rather than refer the patient to go to a proper medical laboratory for testing, I try to juggle this testing. They are facultative because they are, by reason of their training, they have a semblance exposure to what happens in medical laboratory, and so they have adopted to practice their profession. So they are part of those who fuel wrong diagnosis. They are not obligate. People who have nothing to do with healthcare profession, but who, because they feel that there's a lot of gain, in parentheses, holding themselves forth to the public, and of course providing services for a fee as medical laboratory scientists or providing medical lab services. So the cause of wrong diagnosis is multifactorial. And I believe that in the course of this discussion, we will speak more to them. But for the laboratory, quacks, inadequate training, poor laboratory services. So if laboratory services, medical laboratory services are not strengthened in Nigeria, pursuant to the Maputo Protocol of 2008, we will continue to tell tales in Nigeria.
Many thanks, Dr. Ifeanyi. You have hit the nail, on so many points, as regards this particular topic, and very interesting to listen to you. But I'd like to get to Dr. Agbide now. Dr. Ifeanyi has exposed all the many issues that they are. But in your own point of view, would you say that these are the only problems, when it comes to wrong diagnosis in Nigeria?
Well, thank you very much. I would like once again to thank NTA for this opportunity. Just before we came in, we were discussing and we said that this topic is actually topical and germane. It is rightly timed. Because when you make a wrong diagnosis, I think the purpose of doctors or anybody, healthcare professionals attending to their own patient is to deliver health, is to heal them. But with a wrong diagnosis, you cannot, it is just like you are pursuing a rat and then you feel that you are pursuing maybe an antelope. Or those things are two different scenarios. I want to thank Dr. Ifeanyi very much for his expose. But from my own point of view, I would like to narrow down the reasons for wrong diagnosis. This is specifically amongst the professionals. What really happened, we have failed to understand certain basic tenets of life. For example, man is a tripartite. That is, you talk about the body, the soul, and the spirit. In the course of our medical training, we focus mainly on the body. You look at it and you are taught everything that you'll be able to say that this is what is wrong with the body. And in the course of that too, we were kind of narrowed Because basically, if you look at life starts from a single cell. Group of cells come together to form what? Form tissues. Tissues come together to form organs. Organs come together to form, systems. Now here we are, when we're looking at, a patient, take for example cancer. You're looking at, organ base. But cancer, if you look at the etiopathogenesis or the pathophysiology, how it came to be manifested, happens a lot more of that. It starts at the cellular level, when the cell loses its own function. And the whole concept of disease is simply when the cell lacks the ability to be at ease. That's why we say it is dis-ease. So, having said that, if you are looking at what you found from your laboratory investigations, or be it radiological or histopathology or hematology or all this and that, you put together that make a final diagnosis. Because in the course of your interaction with the patient, the first thing you do is take history, examination, and then you depend on the lab to make a final diagnosis. However, the body is made up of different systems, about 9 systems, and these systems all are linked together. So if you just focus on an organ, that this is, the problem, you will be missing out a lot. A case in point, let me give you a case study briefly. A 46-year-old man was diagnosed with what they call CKD, that is chronic kidney disease. He had been all over places, one hospital to the other. And this is, finally, he came to our center. And just like it was, I was introduced, ours is a holistic integrative medicine center. So my chief, consultant said, look, this man, 46, he's too young to really be suffering from, CKD that was suspected to be, due to hypertension. So with the holistic approach, we started investigating. And the essence of this story is to tell you how, without a holistic approach, you can miss out a diagnosis. And you will say it's a wrong diagnosis. This guy was, so he had CKD. He was even at the point of, he was undergoing dialysis. And we said, no, he's too young. Something must be wrong. Started investigating. We ordered what we call the, renal, Doppler, which is ultrasonic. Now we found that there was a problem. Now we went ahead and said, well, with that kind of result, and renal Doppler simply tells you the blood, flow into the kidney, because we were trying to rule out what we call secondary, CKD due to secondary hypertension. Now, when we found that that was positive, there was kind of stasis in the blood flow to the kidneys, we now ordered what they call angiography. The angiography result came and confirmed that there was a problem. Now, let me use it to articulate the importance of integrative approach. At that point, we had to get a vascular surgeon. Because what you see, this guy all the time, he was being treated against hypertension. Because you see his systolic and diastolic values that are up there in the air. But it's a lot more than that. And listen to the story. The vascular surgeon came in and made his own input and confirmed what we were suspecting. Basically, this guy, the blood supply to the kidney through the arterial blood supply to the kidney, what we call the renal artery, was actually stenosis. And if you look at stenosis, there will definitely be impairment of blood flow, and definitely there will be a backup in the pressure, which we call hypertension. If you kept giving this guy all the antihypertensive drugs in the world that and he was diagnosed at the age of 23. He was now 46 when he came to us. So, the vascular surgeon now, they have new ways of handling these cases. they have to do what they call angioplastic, surgery. And the moment the arterial blood supply was actually straightened out, that was all.
So
This guy was a candidate for renal transplant. So what I'm saying here is this: if without proper investigation, you can make a misdiagnosis.
From what you're saying, it means that, misdiagnosis is not likely going to go away anytime soon, because it looks like it's a complicated thing to properly diagnose a patient, especially when you have some critical ailment, from what you've said. Because, when you say holistic, you need to get like a whole team. Like, it's not just about the medical lab scientists alone. You need to get all other professionals to come, do all the diagnosis. Is that what your point is?
Short answer to that is look at the root cause of the problem. Don't just assume with the science and then
root cause of the problem. Would that mean that our health professionals are not properly trained or knowledgeable enough to know the right diagnosis?
I would dare not say that. To my pride, what I know, Nigerian doctors, at least as of the time I went to school, were the best in the world. And that's why when we go out of this climb, we actually excel. Take Nigerian doctors out of the United States health system today, there will be a crisis. It will crash.
All right, Dr. Agbide, we'll come back to you. Let's get to, Dr. Afiz. He was nodding when you were speaking. You seemed to understand some of the terms. I didn't quite, because that's understandable. But speak to us from your perspective, because you are a consultant neurosurgeon. When it comes to misdiagnosis in this aspect of medicine, what's the percentage?
Okay, thank you so much. Once again, good morning, Nigerians. Let me give, before I delve into specifics, generally, as you said, misdiagnosis is not likely to leave us. It's not all the time as a result of negligence or poor knowledge. Let me just quickly give an instance. I saw a patient just 2 days ago. She had been to the United States. She was wrongly diagnosed.
In the United States?
In the United States. She came here, she was in Delta State. She hovered around the entire state, was also misdiagnosed. Do you know why? She had two symptoms coexisting. She's an elderly woman, 80 years old. Of course, sorry, apologies to my elderly seniors here. Age-related diseases are common in advanced age. So she has cervical spondylosis with some symptoms, of course, radicular pains. And she also has this pain whenever she tries to put her hand behind. That is really excruciating. When I saw her, I said, okay, yeah, you have a background cervical spondylosis. That is age-related compression of the nerves at the neck. But the most disabling problem she actually has is trying to put her hand there, which is as a result of a rotator cuff tendinitis. And someone had already counseled her for spinal cord surgery.
Yeah.
So I was in the same room with an orthopedic surgeon, and I said, sir, please, can you take a look at this? And honestly, he just gave an injection into the into the articular. The pain disappeared there.
This is something she has gone to the U.S.
She has gone to the U.S. Yeah. So, just as you said, it's not really likely to leave us because you tend to have that. But coming to the one that is really like a monster in the society is that, okay, this patient has this disease, obvious disease, and you couldn't pick it. It's common everywhere. It's not limited to Nigeria alone. In the UK, a recent study shows that 74 out of 2,131 consultations were wrong diagnosis. And out of this, about 45 out of them are cancer patients, just as he said. When he was talking, I was also nodding my head because he actually provided facts and figures. Cancer patients. Coming down to our own environment, misdiagnosis starts from, when you want to make a diagnosis, it starts from who is seeing the patient first. The doctor will have to take a detailed history. As my senior earlier said, Nigerians are still the best doctors in the world till we speak. But the standard is gradually declining regarding the quality of the doctors we push out from our medical schools. So if you don't actually have adequate knowledge, you can't make adequate diagnosis. You can't send the patient for the right investigations to be done. Now, let me now talk about the broader view. This is on the healthcare provider side. On the patient side, an average Nigerian, if he has a problem, will prefer to go to chemist or to go to someone who is not trained. And that person will send him for a wrong investigation. They say, no, we're having typhoid and malaria. That's the commonest. Yeah. They treated everybody for malaria and typhoid. I've operated a baby, brain tumor. They were managing for typhoid and malaria. And this baby had brain tumor that requires my attention. They had to go in to remove. And after the surgery, the baby was fine. It was like a miracle. So it's like a two-way thing. But commonly in our environment, the patients themselves are actually the culprits.
All right.
They don't seek the...
But we also have, that's not to rule out. We've traveled to America to say, okay, there's also misdiagnosis. We are looking at the frequency of it, which we all agree is rampant in these parts. Now, let me get to Dr. Abiodun Oshiemi. When we talk about maybe wrong diagnosis, I mean, a hospital has all the professionals you can think of. You have the laboratory scientists, you have the medical doctor, you have them in different shades. You have dentists, you have all of them. So how much of a challenge, to what extent, do equipment, time pressure, or inadequate staffing lead to wrong diagnosis?
Everybody, and I hope you can hear me. All right, so the issue of misdiagnosis, wrong diagnosis, and so on and so forth, vis-a-vis equipment, is a major one. But let's look at a typical scenario. If somebody comes to you with a complaint, I have temperature and my body feels warm. The natural thing, or I have missed my menses and I think, no doubt, I'm pregnant. So the issue is, what are the procedures for diagnosing and reporting? If you go to many hospitals in Nigeria, for example, many hospitals have very good doctors, and I can boast for them. However, if you ask, how do you diagnose malaria in many hospitals? How do you diagnose diabetes mellitus in many hospitals? You will see that we do not have what you call constant or consistent diagnosis process. In the UK or the US, for example, there is what we call an international classification diagnosis manual. So that if you say ICD, so, each person knows. Now, the equipment we use to make this very interesting and straightforward, you have the surgeon, the neurosurgeon, the general surgeon, and so somebody has an abdominal pain, a neck pain. You can use X-ray for imaging. You can use the CT scan for imaging. You can use the MRI, magnetic resonance imaging, for imaging, all to produce images to make the diagnosis. First and foremost, an X-ray machine is usually not as expensive as a CT scan machine. A CT scan machine is usually not as expensive as an MRI. Not every doctor or facility has access to this high-level equipment in making diagnosis. So first, equipment. Secondly, without the equipment, you also have methods, reagents, chemical reagents that you will use. Some are expensive, and all these are used in getting the results. Therefore, sometimes when you look at an image, you may say, oh, this is actually a liver that has or represents this, but under the MRI is sophisticated equipment. It's able to even take the sections, so that in conclusion, wrong diagnosis, because you asked me with relation to equipment and so, usually occur. And the more you have poorly funded environments, the more you are unable. And I'll just try to share this example with you. A case which by the way, I'm a legal medicine consultant. In other words, I have a degree in legal medicine, and I see cases like this. So a lady came. She already was full term, meaning 9 months. She was in a clinic where she didn't have the money to do the surgery. 9 months. They sent to another hospital. The medical officer saw this lady, collected about 250,000 to perform the cesarean surgery operation to deliver the baby. The doctor then proceeded, and then he came out to tell the husband there was no baby. Now, many doctors will understand what has happened. They were dealing with a case of fibroid. Nobody at any time took records or report of ultrasound, fetal heartbeats. So when I got the case, because they said they swabbed the baby, I asked all the doctors at any time, did anybody do an imaging? They said, no, this woman is poor. The doctor who wanted to do the cesarean section, did you do any surgery? They said, ultrasound. They said, no, this woman was poor. Did you listen to the heartbeats of the baby? They also said, this woman was poor. And therefore, in the absence of any imaging or investigative method, they all missed the diagnosis, and as such, this case is being pursued. They've come to meet me, and we have to, because the doctors failed to apply equipment to investigate, and so that they did what you call a breach in a standard of care to the lady that actually caused a significant damage. Thank you very much.
Dr. CMA, listening to that story, I'm a bit surprised, because pregnancy 9 months, full term, that's what anybody can, be able to figure out. But if that's a case of misdiagnosis, then it means this is a critical issue. But I'd like to get back to you, Dr. Afiz, and that's because I understand that you may not be staying the full circle with us. Earlier when you spoke, you talked about the patients themselves being the issue. And I'm thinking, is it really the patients? What about the issue of distractions? Or if you like, I really do not know what the issues are around medical personnel. Maybe you can tell me, medical professionals. Because these days you go to the hospital, whether because there are so many patients on the queue, they don't want to even listen to what your symptoms are. I say that from a personal experience. Say you're taking a child and you're trying to explain what you have noticed over time and all that. The doctors are just in a hurry to, send you go for this and go for that. They already suspect something even before you're trying to explain what you're going through. So speak to us around that. The fact that medical professionals, I really cannot say what it is. Whether it's a distraction on your part, or if it's the fact that they already have perceived ailments affecting Nigerians. So, once you come, they just say, this is likely what you're going through. Speak about that. And just before you respond, to our viewers, you're free to send questions and comments. And of course, if you have experiences, we want to hear all of them. The number is on the screen, but I'll just mention it for emphasis. 0816-968-8126. We're already having messages, but respond to that.
Okay, all right, thank you. Shortly before I respond to that, let me quickly say something on what the scenario Dr. Abiodun painted. It's actually a bit weird for a doctor to go ahead to perform a cesarean on a pregnancy he hasn't confirmed. I really doubt if that person is a doctor. So many people are parading certificates around. It's very weird. It's I can't really fathom the how. If that's really happening, then it's a serious crisis. That's that. Then on the second matter I talked about regarding the equipment, yes, I really agree with him. I'm coming to the question. Like now, I saw a patient. We see some patients where, okay, patient came with symptoms of CNS problem, convulsion, vomiting, headache, all those things. We did brain imaging. We saw multiple brain tumors. And once you see multiple lesions, most likely it's a secondary, that is, it's spreading from somewhere. We find it extremely difficult to detect the primary. The only diagnostic tool that is like to pick that with high level of sensitivity is a PET CT scan. And in Nigeria, it's just only one center that has it, and it's in Lagos. And you have to book ahead. That's on one side. A patient had been treated for cancer, breast cancer, declared cancer-free. 5 years later, she came to me just like 2 months ago with evidence of spread, recurrence, and spread to the spine. Immediately I did MRI. I said, no, what I'm saying here shows that you have had a cancer in the past, and the cancer is back and has spread to your spinal cord. I took her in for surgery, destabilization, took specimen, sent it to the lab. The lab confirmed that it's a metastatic lesion. What could have been done in our follow-up is to do a PET CT scan that will show the whole body, looking for evidence of spread. But it's only one center that has it in Nigeria, and it's a private center in Lagos.
In Nigeria?
In the whole country. Just Mikio that has it in Lagos. And you have to book a lot of months ahead. So, and it's very expensive again. I think per whatever is around 700,000.
Of course, monopoly will drive prices.
Okay, so that's just on that regarding the infrastructure deficit that you talked about. So going back to your question, I look at it, I'm going to look at it in two ways. Individual factor is there, and also the systemic factor. Systemic factor being that a doctor is in a center overseeing, like, at the particular consultation, seeing like 200 patients. It happens in Nigeria. Go to most of those PHCs, some of those general hospitals, just one doctor is managing the hospital. We are all human. And you can't expect the doctor to give his best. And all the patients on the queue, they want attention at that particular point in time. So definitely the doctor will be taking scanty history. That's on one side. On the second side is individual issue. We are all different. My own consultation, I am not in a hurry. Patients are outside, excuse me please, kindly wait. I'm trying to take my time with these patients. I must make sure I get everything and explain the details of your problems to you and show you the MRI. These are all the problems. Tell the treatment options, what the other options you have, the likely complications, all those things, I explain the details. So that has to do with individual issue. So those are the two ways by which I look at it.
All right. Thank you very much, Dr. Aziz. I have heard a lot of things. I mean, we've talked about lack of equipment as a cause, of wrong diagnosis. We've brought in, Dr. CMA has brought in poverty. I can relate with that, because if you can't afford it, even though in my head I'm asking, medical practice is not charity, but it is humanitarian. Absolutely. So at what point do you assess a patient and say, look, this guy or this woman cannot afford this? Do we just do this, bearing in mind that equipments it's not metered? You've bought the equipment, it's an investment, you run on cost, But there are people you just look at and say, okay, let me do this for you. I don't know at what point that comes in, but let me ask Dr. Ifeanyi, are there standard diagnostic protocols in place? And if they are they followed in practice? Because that's the basis. If we follow in practice, forget the cues, like Dr. Aziz said, leave the cues, leave the worry, leave the stress. If you follow protocols, I believe that we could have fewer wrong diagnosis.
Thank you very much. Before we got in here, we were conversing like my senior brother and friend, yes, did say. And we're talking about paucity of data on wrong diagnosis in this part of the world. And we're trying to hazard as to why do we have that paucity of data. And the truth is that if I go to the hospital today, wrongly diagnosed, I may get harmed, I may also die. So it could lead to untimely death, preventable untimely death. And when that last one happens, preventable untimely death, you know what we used to say? We leave it for God. So we do not conduct an audit. And insofar as we do not conduct an audit, an inquest, we wouldn't have data as to the preponderance of wrong diagnosis. That said, you asked a question about protocol and standards. One of the reasons why wrong diagnosis is commonplace in developing climes, including Nigeria, is that most of our care centers, hospitals, as big as their names, high-falutin sound, do not have entrenched in their care process what is known as quality management system. If we have a quality management system, it's not about machines and equipment and tools. No. Beautiful as they are, because equipment is an integral component of the quality management system. Just one out of over 12. And so if we do not have a quality system in place, it will be difficult for us to pick wrong diagnosis, what I call non-conformities, as they occur. What would quality management system do for you? It's all compassing, so it brings into bear the protocol you have asked of, the standards and their application in the process of care. So if you have a quality management system in place, whether it is for the medical laboratory or for clinical service or for the entire service provided by a hospice, you find out that what it will do for you is that it's not error-proof. It will not eliminate wrong diagnosis. But whenever it does occur, it flags the system. And so when it flags the system, what are you going to do? You do what we call incidence. So when you incident it, what else are you going to do? You do what we call fishbone analysis or root cause analysis. So how did this happen? Where did it come from? So that way you are able to do corrective measures and minimize. That's why it's not very common in developed clime. It's not only about equipments. So now we have protocols here. The challenge we have in Nigeria is that I can tell you, speaking about medical laboratory, both private and public, is that very many people who provide this care do not conform to set standards, to the rules, to the regulation. You just have money. You think that medical laboratory service is an enterprising venture. You get a space. You throw in all manner of equipment there.
But I thought they're certified by your association.
I am coming to that now. You throw all manner of equipment there and you open up shop. No. The Medical Laboratory Science Council of Nigeria is the government flagship agency that must first register your premises, evaluate your premises before you start that shop. And you're using that colloquially. If that is not done, of course, which is the case, it's not done for over 90% of the laboratories we have across the country. It will shock you when Medical Lab Science Council of Nigeria says, I want to enter, for example, I'm using my friend's hospital, National Hospital. Let me look at the practice and practitioners. We will start having issues. Oh, no, you can't come. This is government agency to government agency. Now, I say he has a private facility.
That makes it even worse.
Yeah,
right?
He has a laboratory. And the council says, we have our practitioners in that your hospital. We want to come and see what they are doing, how they do what they are doing, and the atmosphere, the environment, the things you have provided, the standards, the protocols that they are adopting to provide the service on the say, no, you can't come. So you see, when we
are you helpless?
Why are they operating? Why are they operating? Why are these centers
I'm
operating?
happy you're asking this question. You see, one of the things we must speak to if we want to solve wrong diagnosis in Nigeria is to speak to healthcare practitioners. One factor that propels wrong diagnosis is relationship and communication among healthcare professionals. If he sees a patient and he leaves off, there's a place that's right provisional diagnosis, and he leaves it out and sends that patient to come to the lab for any given test, he has already introduced an element that will lead to wrong diagnosis. So that's the aspect of relationship and what? Communication. Do you understand? There's an information he will provide there, and I will now change the methodology I will use to analyze the sample of that patient. But for just not providing that clinical diagnosis or provisional diagnosis, a whole lot could go awry. So the point is that we have standards, we have protocols, we have regulation. Now,
when you are not allowed to enforce all of these, are you helpless?
We are not helpless. What our council has adopted lately is things like advocacy, mentorship. Now, you find out that the council it works in tandem with State's Ministry of Health, for instance, on how to inspect facilities, speaking strictly to medical laboratories, largely private, domiciled in the states. But because the states are interested in what will come to them in terms of revenue, they also frustrate these overtures of collaboration, which is very important. Because when we're discussing wrong diagnosis, what are we really concerned about? We're concerned about patient safety. Patient safety. We're concerned about expected health outcome. We're concerned about trust in the health system.
Are you sure that there's concern about patient safety anymore? Or it's just about making money? The business of healthcare has moved from, like he said, the humanitarian part where you're taking care, yes, where you have conscience, you're looking out for the life of that individual, or we have moved to a phase where it is just a money-making business.
For all time, healthcare will put premium on patient safety for all time. You know why? Why it is so is that out of every 10 patients seeing a doctor or coming for care, one is likely going to have issues with error or wrong diagnosis. 1 out of every 10. So it's an important conversation. Of course, we have people with perverse intent and interest. We can't rule that out. And that is the place where regulation comes in. That is where we need what is called the political will and support for institutions that are provided by government to serve as police to healthcare systems to be given the full support to provide.
All right. Many thanks, Dr. Efeanyi. Dr. Agbede, we'll come back to you shortly, but please, we need to get to Dr. Afiz, and that's because, he's leaving us shortly. I'm still going to ask you about this money-making venture, and if that is why we're drifting from the norms, the rules and the protocols that should exist in the healthcare. I'll give a simple example. Delivery, pregnancies and all. The doctor in Lagos tried to give an example. These days, you see a lot of women are going for cesarean sections, not by choice, but by medical personnel. They just feel it's easier. They make more money from it. They just feel they can handle 20 women in one day instead of waiting for you to go through, labor and waste time and all of that and waste space. Speak about this money, the drive, really, because he's talked about medical facilities, or rather lab centers that just operate even without licenses, without certifications. So if that is not driven for money, then what is it?
Thank you so much once again. Yes, I think I would just want to send a note to all the medical professionals, especially our doctors, to always go back to the Hippocratic Oath that they've sworn at the time of induction. And even if the entire system has collapsed, your moral conscience must not collapse. And that's what's left to you. That's what should actually keep you moving. Medical practice is beyond, it's not just like I'm opening an office, okay, goods and services, beyond that. You talk about patient outcome, safety, and that should be the primary goal. My first goal should be this person should survive. I need to improve the quality of life of this person. That should be the first. Of course, there's no way you can take out the monetary aspect. Of course, I need to take care of myself also. Yeah, I need to fuel my car to come and see you. So if I'm providing good quality service to you, yes, you should pay me for that. So that's where it comes. Well, it shouldn't be mixed. The monetary aspect shouldn't come first. It should be there. These are my charges, but I'm assuring I'm going to give you the top quality service.
What if you don't have money to pay for the services? Where is the humanity?
We always have that options. Like our government hospitals are options compared with most of our government. Let me quickly say this. Nigeria still has one of the cheapest healthcare services in the world.
Yet, some people cannot afford it.
I agree that.
Simple. I
agree with you. The subsidy government is paying on health is more than even that petroleum. Let me just give you an example. If you want to see me, maybe for my private consultation, you pay between, depending on how buoyant you are, minimum you're going to pay 50,000 per consultation. But if you are assuming government institution, you are just paying 1,000 naira. So you can see how government is subsidizing. The same thing goes for the investigation, all those things. You can actually attest to that. How subsidized all those stuffs are. And
so does that mean that healthcare is not available to just the rich?
It's not free. That's what I want to say. In any part of the
world.
Yeah,
I've made that point earlier that it's not charity, Absolutely. But it is humanitarian. It is humanitarian.
The humanitarian aspect of it is that you as a practitioner, you should actually put that in you to ensure that this patient gets the best. Let me quickly say something on what you said earlier regarding amongst specialties, people practicing what they are not supposed to practice. Yeah. This one is a general surgeon and is parading himself as a neurosurgeon or operating at that level. He said with us, even in this Abuja, let's just talk of the villages. Someone who is not trained to do that. Unfortunately, our regulatory body is a bit limited. That's why his point is actually very, very important. Our regulatory body like the MDCN need to be, probably they need to revise the acts that established it in order to checkmate the specialty care. Do you understand? If there's no, where there's no law, there's no sin. If there are no regulations, even in the developed world, if they don't have all those checks and balances, they will also be misbehaving. So that's an aspect that we really need to look into also. Unfortunately, it's not being looked into.
All right, Dr. Aziz, thank you very much. We have some messages coming in from our viewers, and we'd like to take it while you are also still here. And from Engineer Omoyang, who is reaching us from Jos, said this topic is timely. So many lives have been cut short by our medical personnel. Rather than body investigation, they adopt assumption, lack of proper supervision, and negligence on the part of some of our health personnel. Now, to minimize this, he says, training and retraining of our specialized health workers in modern health techniques is vital if we have to eradicate this recurring death trap. And from Dr. Abiodun, question is there any software or application that will help our medical doctors in making diagnosis? Well, he's asking fellow doctors. I wish the doctors in the house respond and call their colleagues to order. I had the same experience, and what the doctor kept saying is, we should be lucky he has not left us here in Nigeria with our problems and gone abroad. This phenomenon is worrisome. Thank you. That's from Gabriel, who reached us from Kefi. And finally, some doctors using AI to find solutions. Even you demand for tests, they refuse, telling you that you are teaching them their work. That's Zahman from Mina, Niger State.
All right, I have some more messages here. This one says, my mother was asthmatic. When she was having medical issues, we took her to the hospital and the diagnosis said she has tuberculosis and started taking drugs. But after some time, we took her to another facility. They discovered that she was not a tuberculosis patient. They stopped her from taking the drugs. I don't know really whether the first hospital we went to are quacks or they don't have a standard to carry out the diagnosis. That's coming from Samuel Luca from Plateau State. This one says the reason why people move to pharmacies is because the hospital charges too much, including general hospitals. And that's Ajay Tumobi Hamza from Lagos. Another one says, my name is Ismail from Buhari, Abuja. We're in trouble in Nigeria, considering the manner and way the medical personnel attend to ordinary Nigerians in government hospital. It is dehumanizing. It is unfortunate. Dr. Agbede. All right. Well, maybe we should get to Dr. Fiz. I think you're leaving us at this time because you need to attend, I'm sure, to patients at the government facility, absolutely, I suppose. All right. So maybe let's just hear your final words. What would be your recommendation really to deal with all of this?
The first is to, everything we've been talking about personal experiences. As Dr. Ifeanyi said, we need a data. It's only when you have a data, you'll be able to identify the enormity of the problem, and you will know, okay, which one to start with.
And who is supposed to provide the data?
Yes, it should be a policy-driven data collection. Each hospital can actually provide that to ensure that there's a clinical audit, either on a monthly basis or a yearly basis, specifically to identify this. But if you don't have data, we'll all be talking, all the comments you've read, all the viewers or listeners, they've had one experience or the other. It doesn't mean it represents the entire situation.
We are now threatening patients with, you are lucky I'm still around. I need to run. I would have left you. We are now threatening patients.
And what are your thoughts about using AI to treat patients? That's the new trend.
using AI, well, I'm not into the use of AI, so I might not be able to speak about it. But all I know is that even if you are using AI, your background, sound, medical knowledge can never be replaced by a computer.
All right. So
that's very, very key. Yeah. So apart from having the data, then forming a policy, each hospital and each department under each hospital must have management protocol. There must be a management protocol agreed by that department. If you see this kind of thing, this is a flow chart, this is what you follow. So that, to a large extent, eliminates what we see in the hospital. And the message to the public, what I know personally is that the public or the patients are the major culprit here. They say the wrong people have been issued.
The wrong people?
Yes.
Some of us have never gone anywhere else apart from government hospitals. So do we see the wrong people in government hospitals?
That is you, sir. But most of the people out there, they go to chemists, they go to wrong set of people. They go to someone who is not trained. They go to, I know of a medical record officer that is operating, that is carrying out surgical procedure.
And you have not reported the person?
Honestly, I reported, well, that was when I was in Kaduna. So, but nothing was laid on to the person. So these are all the things that I think we need to.
All right. Dr. Haruna Hafiz, we'd like to thank you very much for your time. We understand that you have to be somewhere else at this point. So we thank you very much. Dr. Haruna Hafiz is consultant neurosurgeon at the National Hospital, Abuja. Always a pleasure having you, and we thank you very much for your time.
It's a pleasure to be here.
Let's pause here for a break so that when we return, the conversation continues. Please don't go away. All right, many thanks for staying with us. We've been discussing wrong diagnosis on Good Morning Nigeria, and our guests are still here, but bar just one, Dr. Aziz, who has had to leave us to be somewhere else. Now, let me get back here with Dr. John Toabidi. While we were discussing off camera, I was saying, at what point did medical practice, lose the human face? Lose the human face, where in war-torn countries, in Gaza, in some other places where there is war, in Ukraine, you have medical personnel on ground just doing humanitarian job. So why is it difficult to overlook, and I'm particular about the aspect of poverty, because Dr. Aziz said it is the human, that the patient is largely responsible because of who they see, but it's largely because they can't afford it. And so how do we get those who cannot afford, those who are vulnerable, to be attended to?
Well, thanks for that question. The truth is, in life, Americans will put it that you got to do what you got to do. I'm a strong believer of humanitarian services, but when you go to the reality of the situation, things have changed, especially for those of us in the private world. You are entirely on your own. The overhead of running your unit is so high that there's a limit to how much you can step down to say you are doing humanitarian services.
What makes it very high? What are the factors that make it very high?
Well, let me give a typical example of what I do. Most of the things I use, they are not available in this country. In Nigeria. I have to buy them from the US, Europe, or Germany, or even Australia. Specifically, we use a lot of micronutrients. Vitamin D, injectable, for example. We don't produce that. Now, with the global economic meltdown and policies that have been set in, the forex, what you call the exchange rate of our naira or the dollar to the naira is so, the disparity is what you cannot even begin to, imagine. As of last week, I made an order from the United States, and I made it $1 to 1,650 naira. Then I bring that product here because someone is not in a position to pay. I render the services free. There is a limit to how much I can render for free. The best I can do, and in medical practice what we do, you charge based on the people's income to a certain extent. Where a poor woman who I know that her income is maybe 50,000 maybe a year, when she comes to me, when I know that vitamin D, one dose alone, is about 50,000. There's no way I will ask her to pay 50,000. Some cases, I will even do it free for her. However, when that guy who is blessed and has more, he comes in, he pays that. So it enables me to be in business. But to declare, the doors, my doors open that anybody comes in that cannot afford, I should treat them, free.
It's difficult to do.
Over time, it is not sustainable.
All right. Let's get Dr. CME. I'll get to Dr. Ifeanyi so that we get the government, sector, the public sector perspective to this. But Dr. CME, how easy is it for the sake of getting it right, to deal with patients that are not well to do?
So first and foremost, on this subject matter, the patient is the king. Everything is about the patient. But let me just tell you something. Are you aware that myself and the other specialists on this program, if we are all abroad, you will take your phone to verify if we are specialists indeed. Do you know, very sadly, all the viewers all over the world watching us, including yourselves, you can't even verify if Dr. Oshiemi is a specialist, and if he's a specialist, if he's in a good standard, a good standing. I just want to throw this at you that our system has tried a lot and God is helping us. However, shouldn't people even be able to put on their phone Dr. Oshiemi and see the specialty, Dr. Agbede and the other people? If we cannot do this, then there must be more quacks than qualified people, because the quacks know you cannot differentiate us from the other. Also, this subject matter on wrong diagnosis or not falls under the auspices of medical negligence. And if people do not know the impact of wrongdoing, then why shouldn't they continue the wrongdoing? So I know that I belong to membership in the Royal College in London, Chartered Society of Forensic Science. You only need to put my name and you can see if I'm a member and in good standing or not. And so I need you to understand that in Nigeria, even colleague to colleague, I don't know who is a quack, who is not a quack, and I can't verify. And so even though the Medical and Dental Council, Laboratory Association, everybody is trying, I want to encourage them to help the public that we can now start questioning ourselves and so on and so forth. Secondly, we should encourage revalidation of professionalism. Medical diagnosis and wrong diagnosis is not only about doctors, it's about the entire health practitioners. And there must be revalidation processes and good standing, but the competence or capacities to do that, we don't have all. But now to your question. Humanitarian means conducting business or conducting livelihood with human face. Charity means you are doing something for not for profit. Therefore, every doctor, every lawyer, and every banker must have human face. Human face simply means I, as a lawyer, will use my skills to help this man from the hangman. I, as a doctor, will attend to this person's fiscal needs. I, as a banker, will use cash. However, charity also must be differentiated. Charity means we are established not for profit. Once is a private business, we are expected to give the return on investments. However, we must have humanitarian face, but we are not charitable organization. We are humanitarian face, we are charitable organization. So don't let us misconcept or misconstrue humanitarian to be a quality of only doctors, lawyers, priests. Every human being must be humanitarian in their practices. However, if you are a private-based hospital, yes, humanitarian shows you must show empathy. You must have a feeling. You must to clear that I am not into a charity business, but I'm 100% into humanitarian business. As a doctor, that is the Hippocratic Oath. And it's not just about doctors, it's virtually every human being must be in a humanitarian business. However, just let's think about it. The greatest problem people have is about nutrition and hunger and sunlight and so on. Can we go to Sheraton and all this place and remind them, you are in a humanitarian service. I am hungry. I only need quarter chicken. I only need half of 2 wraps of pounded yam and a 40 roll. You are humanitarian. I think they will tell you you've lost it. But sincerely, humanitarian is not a very big grandiloquent word. But are you out for business? Are you out for charity? It will also determine how you are funded. So I thank Nigerian healthcare professionals and not doctors. And you guys on the TV screen, you're actually also doing something humanitarian, but you're conscious that adverts will be heavily charged. That's it.
Dr.
You don't want to know
Oshiemi,
how much we do.
Dr. Oshiemi, I can say for a fact that it's not, all adverts. It's really for those that, do good to the public.
What's the percentage of adverts?
We have a lot of
for
health
us?
jingles and all that are running on the NTA. I can speak for the NTA that are absolutely
Fantastic.
free.
to know.
But you see, I like what you have said about registration of doctors and all. But this misdiagnosis doesn't just rest on the doctors alone. The medical lab practitioners, or if you like, professionals, are a key part of all of this. What can we do? We're trying to find solutions now. What can we do such that, if a sample is taken, it's actually true that the person has malaria and not that, because, everybody has malaria in Nigeria, you just go plus. And then, you're just, all of that. How do we get this checked? Get the labs certified, get the professionals, knowledgeable to do the right thing. And just so that, we begin to get right results and then, of course, they get right treatment.
So the answer is pretty simple. And that was what makes you a legal medicine expert. You see, in England, if you are a practitioner and you have done a wrongdoing, if you type the person's name, you will see this person currently on suspension, this person already banned from practice. In Nigeria, you cannot go online to see the good standing of a person unless people know that from their action, their names and standing shall be published. And people can actually know what they are standing. And these are the days of what you call soft power. Once people see your standing, they will publish it and it will go viral that you are not. So first and foremost is, how can we prevent those who are not fit to practice to keep practicing? That is not established. So if I'm not going to be sanctioned and I'm not qualified, why shouldn't I take advantage of the situation? Secondly, also will then be, how do we practice? So the benchmarks are not the same, and you can hear some of the regulators identifying some of the challenges. So the challenges will therefore come from revalidation, enforcement, and what you call collaboratory efforts. Sometimes some of these people, when you do wrongdoing, let me give you a typical case. The man called Adamaku is a classical example of gross medical negligence. A medical negligence is where a person falls short of duty of care and it has come to a wrong outcome. Sometimes it's not deliberate or serious. Adamaku, an anesthetist in United Kingdom, was during an operation fell short of duty of care. The tube that should be supplying gas and necessary thing to keep the man alive was not done. The patient died. This was gross medical negligence. You fell short of duty, you didn't do your duty, and led to death. Adamaku.
Dr. Oshiemi, thank you very much. We don't have a lot of time at the moment. We have, borderline red at the moment. But let me quickly get to Dr. Kasmir Ifeanyi. Now, a lot of issues have been identified, and I'm leaving this with you because if medical laboratory scientists get it right, we are going to crash the numbers as far as wrong diagnosis, misdiagnosis are concerned. So how do we begin to get it right? To what extent are weak institutions a problem in all of this?
For instance, I had said earlier on that the Medical Laboratory Science Council of Nigeria is government flagship agency for the regulation of the education, training, practice, and practitioners in medical lab science. And I must say it's not a weak institution. However, it has encountered some of the hurdles I had highlighted earlier on when I spoke. They must be given free hand to look into places of practice, public or private. Look at the activities of practitioners in these facilities, be them university teaching hospital, federal medical centers, private hospitals, and private medical laboratories. That must be done. And I must say, also bring to fore that before you get your license to practice as a medical laboratory scientist in Nigeria renewed, you must have earned the requisite continuing professional development points. It's compulsory. And the idea is to provide avenue for retraining, for bringing practitioners to be attuned to cutting-edge information and knowledge.
Is this a plan, or is
it's in practice? It's not new. It's not new.
It's in practice, but not implemented.
It's fully implemented. Now, before now, if you apply for your license, it will take you donkey time to get. If I apply for my license now, before the close of work today, I'll see it on my phone. So there's a lot of innovation coming.
So can we now verify medical lab?
Of course, if you go to the portal of the Medical Lab Science Council of Nigeria, you will see for yourself private laboratories, for instance, that are duly registered with the council.
Right,
you will also see some government laboratories, particularly military hospitals, that have their labs fully accredited. Okay. That's not happening, and we need that to happen. So if we're going to deal with the issue of wrong diagnosis, we must put premium on strengthening medical laboratory service. And I must give it to this current administration.
Thank you very much. Because
the Ministry of Health is doing a lot in investing in diagnostics, and it's commendable, but we need to do the aspect of human resource retraining and retraining.
Thank you very much, Dr. Ifeanyi. We're out of time. I'd like Dr. Agbidi, in 30 seconds, please. What will be your last words, in dealing with all of this?
Well, we must admit that the problem of wrong diagnosis is there. But I believe in solutions. And the solution is that there should be training and retraining of all workers involved with diagnosis, especially the labs. Then, even the medical doctors, we have to change our approach on how we make and interpret, our diagnosis. These days, there are modern and sophisticated equipment. Take, for example, the area of, energy medicine, where you use things like Undermed. Undermed uses post-electromagnetic frequency detection. And you sit on this machine, it is able to tell you what is wrong. It looks at the system, organs, and this thing. Thirdly, people should be up and running. Take responsibility. Don't wait for the government alone. But the government must also do something.
Of course, the government must do something. Thank you so much. I think this is the point where we'll have to end the conversation because of time. But of course, it's a continuous one, and we hope that we find all the answers to all the questions that have been raised. Dr. John Tor Agbidi, neurotoxicologist and integrative medicine expert, founder and CEO in-country Medicare Abuja. Many thanks for being our guest. We do sincerely appreciate you.
Always my pleasure.
For your time. And of course, Dr. Kasmir Ifeanyi, 15th National President, Association of Medical Laboratory Scientists of Nigeria, Fellow West Africa Postgraduate College of Medicine, Laboratory Science, and a public health advocate. Many thanks for your insights. And of course, we look forward to having you some other time. Of course, we also want to appreciate Dr. Abiodun Oshiemi, CEO Forensic Science Consultants, legal medicine consultant, Oxford Health consultant. Many thanks for being our guest. And when you get to Sheraton to ask for that free meal, I'd like to tag along. Of course, Dr. Aruna Fees, consultant, neurosurgeon, National Hospital, Abuja, who had to leave us in the course of the conversation. Of course, it's been a very interesting one. Mienre John, take care of your health and enjoy your weekend.
All right, and I am Victor, as we will come back here Monday. See you then.